This episode of Doc Talk is brought to you by First Bank. We're not just your neighborhood bank, we're your neighbors. Our local team lives up to the name, putting our customers and community first. To experience First Bank difference, stop by any of our 13 Knoxville area locations or visit firstbankonline.com. First Bank, member FDIC.
Hello, my name is Dr. Rob Page and welcome to Doc Talk. Doc Talk is a podcast that is produced by the Knoxville Academy of Medicine and features its member physicians giving information to patients that is either current, contemporary, novel, or will help them in their healthcare decisions. And with me today, I'm glad to have Dr. David Scudder. Dr. Scudder is a surgeon with Premier Surgical, and he's going to be here today talking to us about the gallbladder.
Yep.
About the gallbladder. So let's start off with nuts and bolts. What is the gallbladder? What does the gallbladder do? Why do we need a gallbladder?
Sure. All right. Well, so your gallbladder is an abdominal organ. It's located in your abdomen, kind of right underneath the bottom part of your ribs on the right side, right underneath your liver. And I tell patients it's basically like a Tupperware container. Okay. It doesn't really make anything. It just holds stuff. Okay. And what it holds is something called bile or gall. So gallbladder, it's an organ that holds that. Okay. So bile is a liquid basically that helps us absorb fats. So when you eat a delicious meal, you know, like all of us love ribs, chicken wings, something with a lot of fat in it.
Cracker Barrel.
Cracker Barrel, exactly. Old CB. And then your gallbladder starts to contract, and that bile shoots out a little tube called a duct into your bowels and helps you absorb fat. So that's the point.
So that's how the gallbladder functions. Now, the problem becomes, though, is when our gallbladder doesn't function correctly. And if our gallbladder isn't, we it's sort of kind of know where it is, but what sort of symptoms would we be having if we were having problems with our gallbladder?
Sure. So there's kind of a wide assortment of symptoms, but most common ones are going to be postprandial pain, meaning you have a delicious dinner and then 30 minutes later, somewhere in that range, you're going to start going, I'm feeling this pain kind of right underneath my ribs, maybe in the middle, a little to the right side. And that can be pretty painful sometimes. Some will come into me and say, that was worse than when I had a kid. That was the worst thing I ever had. And other people say, I just feel kind of uncomfortable, just a little different. So that's kind of most common. Other ones, people can just feel nauseated, can feel kind of fatigued, can have nausea with emesis too. And then just
so throwing up and
throwing up, and then sometimes have kind of out the other and can have some diarrhea following it, things like that. But usually kind of associated with food, kind of in that general area where your gallbladder lives. You're going to have pain, upset stomach, nausea, vomiting, those sorts of things.
Now, are there any sort of atypical or unusual presentations where we can have pain that's elsewhere, or maybe?
Sure. Yeah. So this is actually pretty common. People will come in and they'll describe this middle chest pain. So people think, especially if you're kind of in the right demographic, am I having a heart attack? Is something like that going on? And so they'll work them up. They'll do the whole bit looking for heart. It's not your heart. And then they'll get an ultrasound and they'll say, it's your gallbladder.
Gotcha.
So that's kind of one of those to watch out for too.
Gotcha. So let's say that I'm a patient and I'm experiencing these problems, experiencing these pains. I'm concerned about maybe some problems with my gallbladder. Are there studies that I should have done? Are there ways that I should approach my primary care or my doctor about how this should be approached to see if I have any problems with my gallbladder? What sort of things should I ask about, or how should I approach my primary care?
Bet. So if you're listening to this and you're kind of wondering, I've got some abdominal pain, maybe I've been nauseated after eating, something like that, bring it up to your primary care doctor, talk about it, and see if there's anything that can be kind of in line and worth investigating. And what he'll probably do is a pretty simple and painless test, which is just an ultrasound. And from that ultrasound, you can see, well, if there's gallstones, if the gallbladder looks bigger than normal, does it look kind of like there's a problem with just the entire organ itself? And if they find something there or they don't find something there, they can do another study, which is really common, called a HIDA scan. And a HIDA scan is basically a fancy test to see if your gallbladder is functioning. It'll tell you if the gallbladder is taking in bile, if it's actually ejecting bile out, if it's working at all, that sort of thing.
Now, now is this HIDA scan, is this something that I would have to go under anesthesia for? Is it an invasive procedure, or is it just something, is it similar? An ultrasound, we know it's just basically on the surface of the skin, but a HIDA scan, that's, what would that involve if I were, as a patient?
Sure. So it's as painless as an ultrasound, okay? It's outpatient, there's no sedation needed. They just give you basically a special type of radio tracer that shows if the gallbladder functions or not. So they just give you a little medication, which is harmless, take some pictures, and that's it.
Gotcha. And is this something that takes a while, or is this fairly rapid? Or
typically an hour.
Okay.
Okay. You should know if things are going the right direction or not. If they're still not seeing anything, they want to be sure. Sometimes they'll stretch it out to a couple of hours. Ultrasound, of course, is a little bit faster than that, but usually an hour to 2 hours.
Gotcha. So I'm a patient. I've gotten the ultrasound. It turns out I've got gallstones. Symptomatic gallstones. I'm having a lot of problems after I eat. I then get referred to you, the surgeon. Mm-hmm. So I come in and visit you the first time. What sort of workup do you initially do? How long would I, do you evaluate me to see if I actually need surgery? Is this a surgery? What sort of procedures do you do initially when you see a patient to evaluate them for their gallbladder disease?
Sure. So I would kind of corroborate what has already been done by their primary care doc. Okay. So I'd review, obviously, ultrasound, if there's any other scans, their lab tests, see if there's anything more going on or different going on to isolate definitely the right diagnosis, okay? And that's literally just through talking to the patient, you can find out almost everything you need to know. A couple of tests that have usually been done, and if not, I get an ultrasound, HIDA scan, any other tests that I think would help maybe rule out differential diagnosis types of things. And then I talk to the patient about, well, how's your diet? Yeah. I say, well, I eat chicken wings and bacon, and I say, I do too, but I don't have gallstones, so they don't bother me typically. So then it's kind of a real conversation with them saying, all right, well, do you think we can try doing diet adjustments, see how that goes? Or you're saying, I never want to have this pain again. So I say, all right, well, let's talk about what to do next.
So basically it comes down to how bad it is for me. Basically, how does it affect my quality of life? And if it's severe enough, if the patient decides if it's severe enough, and you decide that's a good treatment for them, they become a surgical candidate. So the surgery in and of itself, how long does it take? Does insurance generally pay for it? Is this something that I would have to basically map out a lot of time for? Would I have to take a lot of time off work? Would I have to stay in the hospital as an inpatient? What sort of things would that involve?
You bet. So it's one of the most common surgeries that general surgeons do. I do them all the time. Even in my young career, I've done close to 1,000 of these.
Oh, wow.
So it is a same-day surgery, which is nice. So come in, go home, same day.
That's great.
My time for a gallbladder is usually about 30 minutes is all.
Wow.
So now you're in the hospital a little bit longer than that, of course, because you got to get there, meet the people, say hi to them. You don't have to remember names. I do my job. Make sure you're speaking English, eating, drinking, and then you go home, okay?
Gotcha. Wow.
So sometimes they take a little bit longer than that, just depends on how severe the disease is. Gotcha. Sometimes the gallbladder is scarred in, sometimes there's infection present, things like that. So it's a little bit more of a severe case. But as far as timeline following surgery and getting back to just you being you, I typically say 2 weeks when you see me, you're feeling about 85, 90%, okay? So a couple of days after surgery, you're gonna feel some general soreness, nothing too severe really, just you're gonna have a couple of small incisions. Biggest one's only 1 centimeter.
Oh, wow.
Okay, the other 3 are 5 millimeters, 4 total.
And where are these incisions? Are they sort of generally across the abdomen? We're talking 3 very small incisions. Where do these go?
Sure. So the largest one is right by your belly button. I try to hide it kind of in the belly button itself, so it'll just, you won't even notice that one. And that's the largest one. And that's the one the gallbladder physically comes out. Now, once in a while, we get a patient that's just won the Guinness record, the biggest gallstone ever. So for them, I apologize. All right, it's got a little bit bigger. But the other 3, right underneath your breastbone, and then right here underneath your ribs on the side. And those are the 3 small ones. It's just about the width of my index finger as you see it.
So not incredibly invasive. We're talking, 4 small surgical incisions. This is a day surgery procedure, so I can show up if I'm from out of town, if I live in Madisonville, or if I'm out in Von Orr, I can drive to Knoxville. I can have the surgery, and then I can't drive home, but I can have someone else drive me home,
Yep.
hopefully. Now, insurance, is this something insurance will generally pay for?
Almost always.
Okay.
So the things sometimes we have to satisfy, basically I just got to do my job right to make it work. Okay. So have the proper documentation, and then have an ultrasound or some sort of scan saying this is looking abnormal.
Gotcha.
And there's reason to believe that this is the cause of the problem. And that's it.
Wow. So rapid turnaround.
Mm-hmm.
I don't have to worry about taking a lot of time off work.
No, sir.
Because we have very small incisions, not a lot of recuperation. Hopefully, so what about diet after our surgery? Well, do we go straight back to maybe on our way home, we stop at Cracker Barrel and grab some, chicken and biscuits or some gravy, or probably not, maybe? Or
I mean, you can. I tell patients, you're in charge of your health. It's up to you.
Yeah.
But I advise give your body time to recover from just the anesthesia. So the anesthesia sometimes will make you feel, you have this general anesthesia, you're going to feel just a little bit slower. Your bowels feel that too. They're just a little slower. So if you go and, have a whole pizza, you're not going to feel the greatest, okay?
Gotcha.
So just eat light the first night.
So the pizza's going to be staying with you a little bit longer than normal.
It's going to stick. It's going to stick. Yep. But other than that, I tell people just go for it. Try it out. So of that doesn't mean 100% of people have zero problems.
Gotcha.
So one thing to watch out for is about 10% of the time. So 1 out of 10 people that have their gallbladder taken out, if they have high fatty foods, since there is no gallbladder, well, your bile's got to get into your system a new way. So since the gallbladder is just the reservoir, the Tupperware container, that's gone. Liver makes the bile, has its own set of tubes, gets into the bowel. So, but it's a different rate at which it gets in. So sometimes if you have Cracker Barrel and all of a sudden your body's not quite used to this, what if there's a big rush of bile? So bile is made of cholesterol, bile salts, lecithin, not that important, but part of the constituents. So you put a lot of salt and cholesterol in there. What follows that is water. You have a lot of water rushing to your system. So people can have what's called post-cholecystectomy syndrome, and when they eat something delicious that we all want, like a brisket, 30 minutes later they're having diarrhea.
Gotcha. So something we need to be aware of, and probably wouldn't be a bad idea for us to alter our diet maybe
Unfortunately
anyway.
True.
So
yes.
yeah. So as good as those things are, so I don't need my gallbladder. It's not something that I need to worry about if after surgery I don't need to do anything special because I don't have a gallbladder anymore.
No, sir. So typically, not typically, you will live just as long, just as healthy, and probably better if you get away from all the symptoms you're having as somebody who has their gallbladder.
Gotcha.
Okay.
So and then after that, so we've had the surgery, long-term follow-up. Do we come see you once a week, once a month? How many times do you generally see a patient after the surgery, or is there a follow-up if I'm especially if I'm coming from out of town and I'm thinking about how many times I need to come to Knoxville or how many times I need to come to we'll talk about where your surgery centers are in a minute, but how many times I need to come visit you? What do I generally need to think about in terms of follow-up?
Just once.
Wow.
About 15 minutes is all. Just enough time for me to make sure you're feeling good, answer questions, those incisions look great, and then enjoy your life. You're free.
Wow, that's great. So, well, now let's talk about, so I'm a patient and I'm thinking I have gallbladder problems and I want to contact Dr. Scudder and find out, I've had maybe some ultrasounds done, maybe I haven't, or maybe I just want to contact you. How would I go about that?
Absolutely. So we'll just schedule an appointment at my office.
Okay.
So we can get referrals from your primary care physician. That's one way, and that way we can make sure everything's kind of like following the books. Or if not, just call us.
Okay. And you're with Premier Surgical.
That's right.
And so tell us about Premier Surgical. Where are you located? How would I get there if I were a patient? How would I contact you? And also, if I'm interested in finding some more information, do you guys have a website?
We do, yeah. So premiersurgical.com, and you can go on there.
We'll put that on the bottom of the screen down here.
That's perfect. Just a little ticker. Yeah, nice. I like it. And then so you can find out about me or any of the other surgeons, and we're a large private surgical group in the Knoxville greater area. Our partners kind of are all over the city and the surrounding area, helping out all the various hospitals. So mostly I'm up in the northern part of the city up in Powell at North Knoxville.
Gotcha.
But I also operate at all of our surgery centers. We have a surgery center, and then a physician surgery center. I can go out to Covenant. I can go to the area hospitals. And basically, why I would do that is to meet the patients where they want to be best served.
Gotcha.
Whether that's personal preference or insurance issues, something like that. So that's one way to get us is online, premiersurgical.com. You can always reach us by phone. We can reach our office up in Powell.
And we'll put that telephone number down on the bottom of the screen so you guys can, so the patients can access that. Well, you've given us a lot of very useful information about the gallbladder today. And actually, I think the best part about what you've shared with us is that if we do have problems, it's not something that we generally need to stress about. That we just, essentially need to, bite the bullet, so to speak, and go see the surgeon and have what's a fairly routine, as you said, you've already done 1,000 of them, surgical procedure which won't take a lot of time, which won't give me, won't force me to take a lot of time off work, and I'll have better quality of life because of it.
Yeah, and so just to kind of echo that, I've only been to Knoxville, about 6 months, and gotten to meet a lot of really great people and help a lot of people. But I've heard more than probably 10 times for people that I've done the surgery for say, like, this is the best I felt. This is the best I've felt in years.
I was
and so that's awesome. We're just high-fiving and loving life, and
you
that's
can't
it.
And you can't beat that in terms of quality of life. Well, Dr. Scudder, thank you so much for joining me here today.
Thank you for having me.
And talking to us about gallbladders. And with that concludes this episode of Doc Talk. It's not Doc Talk. See, I got it right this time, David. So, Doc Talk is a podcast that is produced by the Knoxville Academy of Medicine and features its member physicians giving information to patients that are helpful in terms of making their healthcare decisions. I'm Dr. Rob Page, and thank you so much for joining us.
This episode of Doc Talk is brought to you by First Bank. We're not just your neighborhood bank, we're your neighbors. Our local team lives up to the name, putting our customers and community first. To experience First Bank difference, stop by any of our 13 Knoxville area locations or visit firstbankonline.com. First Bank, member FDIC.